So this session is for about 45 minutes. We have 10 minutes each for each of our guests. And then for the rest 15 minutes or so, we can open up for the Q&A. And in the meantime, while our doctors speak, if you have any questions, you can write it down in the chat box so we can take it up. We can compile and take it up accordingly. Dr. Nalini, we'll start with you.
Thank you, Rishabh. And I thought that Professor Khadilkar is going to speak first, so that there's an introduction on the. Sir is there. Sir is to speak first. Nice, sir. Thank you so much. Because no. I think you should speak. Then the flow is there, because I just go with the beginning of without any introduction to GNE. So I thought that Professor Khadilkar should speak first.
Sure, Dr. Khadilkar will start with you.
Rishabh, can you just tell me what all should I cover? Sorry, just a little out at the moment. There was some emergency that came up.
Sure. Yeah. So basically, management of GNE myopathy, what can patients do to maintain muscle strength, and any tips to them to improve their quality of life?
Right. And how many minutes you want me?
10 minutes, preferably.
Okay. Great. First of all, I must say that this event is one of the very good events that has been organized, and it's so rare to have a focused event on one disease. There are very few meetings where you deal with only one disease at a time. So I must compliment all the organizers, Shilpi and Rishabh and Sudha and everyone. And I would also like to thank all my colleagues who have found time to be here. I mean, with this Zoom, it has become so amorphous that every day you end up doing a few meetings, and sometimes you actually forget what are you supposed to do in the day. So here we are, and I think the task that Rishabh wants me to do is to go over a few aspects of management of the GA. And I know that you're all very conversant with the disease diagnosis and how the diagnosis is achieved and things like that. But let me make a few points. And some of the points are that even though GNE myopathy is a distal myopathy, and people get weakness of the foot muscles first, it also does produce a certain degree of weakness of the thighs and the torso, and sometimes in the upper limbs also, as we know, in the small muscles of the hand and others. So even though you all will sort of hear about this in the category of distal myopathy, there is a proximal and a distal weakness in most of the patients that we see at some stage in the illness, and usually pretty quickly, usually within a few months to a year, 2 years. Weakness of the proximal as well as distal muscles does develop. And I do feel that this fact is slightly under-recognized. And this is an important fact in the way we totally look at the patients. The experts who are here, Dr. Nalini, Dr. Vishnu, will agree with me that the proximal weakness is a part of the whole phenotype. So having said that, the management really involves various parts. First is an accurate diagnosis. I think it's preferable that the diagnosis is achieved genetically and or with a muscle biopsy. You will require to do muscle biopsy in patients in whom the gene shows variants of unknown significance or shows one pathogenic variant. Then you will do a muscle biopsy. After a secure diagnosis is achieved, then comes the question of how does one maintain the strength of the muscles in this disease. Now, for any muscular dystrophy or any myopathy for that matter, as you know, the cellular working of the muscles is affected, and therefore the muscle's ability to contract and relax changes. and therefore muscles develop weakness. And when such muscles are exercised, sometimes they get more damaged as well. So it's extremely important to appreciate the principles of physiotherapy in the GNE myopathy, because physiotherapy will form the mainstay of treatment for these conditions. Firstly, you will have to go to somebody who understands physiotherapy for this disease, because it's slightly different from physiotherapy in general. So you should actually contact somebody who has experience with physiotherapy of myopathies, and in particular distal myopathies. Now, when a diagnosis is made and we tell patients, look, physiotherapy is very important, some of them put their heart and soul into it. And they actually want to do more than what they should be doing. So one very important tip is that if you have got 100% strength, you should utilize 80% energy in trying to do the exercises. This is important, because if you push mind over the body and if you go on pushing beyond 100%, then there can be a little bit of difficulty and muscles can actually become weaker. So your physiotherapist has to understand what is your 100%. You have to understand what is your 100%. And then you have to do physiotherapy, which involves 80% of your strength. You require two types of things. You require stretching exercises and you require strengthening exercises. Because as you know, some muscles get weaker and some muscles don't get weak. So those muscles that don't get weak pull the muscles that are weak, and therefore postures and contractures tend to develop. And stretchings seem to help that situation quite a bit. So you require stretching and strengthening exercises. You require the intensity to be modulated. And I think regular physiotherapy, being regular with the physiotherapy, is also very important. So one aspect is the physiotherapy. Second is the orthosis. Orthosis is where appliances are used to try and improve the gait and balance. And one very common appliance that is used in this situation is the AFO, where the foot dorsiflexion is supported by a splint. And AFO does help people to improve the gait and their balance, and they fall less off. Now, having seen this scene for a while, I realized that getting an AFO that is good for you requires a lot of skill on the base by the person who actually creates the AFO. All ready-made AFOs are not good. In fact, there are a lot of people whom I have seen where the AFOs are so heavy that they say, look, we are better off without them. So they need to use the acrylic materials, they need to use the thin materials, they need to make it, tailor it to your requirement. But a good AFO will go long. Now, in GNE myopathy, the quadriceps muscle is usually very strong. So knee buckling is not that much of a problem. Only exceptionally knee buckling is a problem. But you require the AFO. Some patients also require the special exercises of the upper limbs, because in a proportion of them, the distal hand muscles waste away in quite early in the illness. So there's physiotherapy, then there is the appliances. Then comes the role of nutrition. Those who are overweight should lose a certain degree of weight in discussion with the dietitian, so that it's that much easier for the muscles to carry them. Also, you know that proteins form the substrate for muscles. So your diet should have a good balance of proteins, fats, macronutrients, vitamins, so that the energy required for the muscle is created. And I normally suggest that they can take a little bit of extra protein in whichever form they want to take, like sprouts they can have, curd they can have, the Protein X powder is okay. Any one source that they choose, but proteins are very important. Now, again, some patients I find they overdo their protein requirement, and that leads to different problems. Uric acid increases, other things happen. So again, you need to be in touch with your doctor and your physiotherapist as to how you're going, and the dietitian. Now, luckily, the cardiac muscle and the other involuntary muscles are not affected much in the
Khadilkar, just 2 more minutes.
Yeah. So I think one need not worry too much about the cardiac issues, but some patients do have minor problems. So it's important to also look at the ECG and 2D echo, the lung function, the spine function. So to sum it up, it's a combination of positive thinking, positive actions along physiotherapy, orthosis, weight control, nutrition, and the last one that I didn't mention was good rest. Rest is recuperative, so getting good sleep is very important. So I would urge patients to do these 4 or 5 things to keep themselves as well as they can till the doctors find out better remedies for them. Again, Shilpi, Rushabh, Sudha, and everyone, thank you very much for asking me to be here. And as usual, I thoroughly enjoyed these interactions. Thank you very much, and have a good learning day.
Thank you so much, Dr. Khadilkar. That was so very well put. I'm sure so many patients would have benefited from it. It's very simplified for layman patient to understand as well. So thank you once again for being with us.
Thank you.
Next, we'll go to Dr. Nalini. Dr. Nalini, what is natural history? What is its importance, and how will it help in testing future drugs for clinical trials?
Thank you. So quickly to talk about natural history and why is it important and how does it help in testing future drugs. Okay. So for any disease, we know that the natural history has sort of a stereotype pattern of evolution. So we do have a pre-symptomatic stage when the disease does exist, but there are no manifestations, and it can get stimulated either by internal or an external agent. And then basically there is some tissue changes or physiological changes, which is pre-symptomatic, and the patient is unaware of these changes most of the time. And then followed by the signs and symptoms, which are classical of any particular given disease. And the disease could be short-lived or long-lived or chronic over several months, years, or decades. And then there's a classical manifestations of the illness leading on to disability, in particularly degenerative diseases. And this could be interrupted either with treatment or spontaneous recovery, and the course or the natural history could end here. But given the conditions like GNE myopathy and other inherited degenerative disorders, the relentless progression continues, and there is a disability which progresses onto a chronic stage until death. So basically, the natural history is a study to collect information about the natural course of a disease in the absence of an intervention. So from the onset, either to its resolution or to the individual's death. And the knowledge is very important for drug development for many common as well as rare disorders, and particularly diseases like GNE myopathy. And natural history is not available or is incomplete for most rare diseases, including GNE myopathy. And this information is particularly needed for disorders where drug discovery needs to be attempted. The natural history is also important in planning controlled trials of investigational drugs to treat rare disorders. So what do we exactly do in a natural history study? It is pre-planned observational study to track the course of a given illness which has been targeted. And the starting point is actually the collection, the organization, and analysis of all currently available data. So I will be later on speaking about how we have collected the data on GNE myopathy over the last 2.5 decades and tried to look at the disease progression of this disease. Ideally, it's a retrospective study. And the natural history purpose is to identify the entire demographic details like the age, sex, gender, genetic predispositions and genetic factors, the environmental factors, treatment, concomitant medications that would correlate to the disease development and outcomes, so that one could plan if there are new drug trials based on the evolution of a given disease. It also includes the current standard of care and emergent care, and which may alter some features of the disease, either if there is a specific drug therapy or there is no therapy at all, or partially it might benefit the natural course of the disease. And once we have a natural history, like for a disease like GNE myopathy, we know what is the common onset, what is the evolution, what is the time to loss of ambulation, time to bedridden state, and time to death. So this could be created by a natural history prospective data, and this could be a model. And during any clinical trial for GNE myopathy, this can serve as an external control, and there is no need to have a control every time that we do a new drug trial. So we do not have such data, and we need to create and keep it handy so that when any new drug arrives into the market or in a trial, it could be compared with the existing natural course of the disease itself, and how does it get altered by the new drug. So disease registries are also a platform to acquire the data for natural history studies, which we really do not have. We should have a national GNE registry, and I think hopefully by the Mayo mission, we would be able to have all of these done. So when we say rare disorders, particularly natural history for rare disorders is important because it's very few cases, and the number of people affected should be less than 5 per 10,000 to call it as a rare disease. And if you see, GNE myopathy is actually an ultra rare disease with 1 to 9 per 100,000 individuals being affected. And we know that more than 7,000 recognized rare diseases are there, but each of them are collectively put together affects about 1 in 10 people in the US. So more rare diseases have no approved therapies, and it presents a significant unmet public health need currently. So natural history helps us in identifying or to develop biomarkers as well, which can lead to diagnostic and prognosis of the disease course, and it can also predict the treatment response of any new drug. So natural history is useful in guiding patient selection and dose selection and drug development programs. And it's also essential for rare disease research and can potentially replace placebo arms in clinical trials. As I already told, that if you have a natural history of a disease well conducted and well documented, if you have clinical trials, you can just compare them with the existing natural history course. And the information of natural history plays an important role at every stage of drug development. And from drug discovery to the design of clinical studies intended to support marketing approval of a drug. So when we talk about natural history studies, there are two types, like retrospective and prospective. See, many times with diseases which have a very rapid evolution, like you want to study on the infections of the brain, which evolves over a few days, few hours, few weeks, you can have a very quick prospective study because the evolution from the onset to recovery or onset to death is very fast. But in degenerative diseases like GNE myopathy, where it runs over months and years and decades, prospective studies are a little difficult because it has to go over, like one GNE natural history study went on for 15 long years. So it's going to be a tremendously difficult task. So retrospective studies, the patient evaluations already exist and are often used as a first steps in collecting natural history information, so that this can be extrapolated to the prospective natural history study as to how to organize or how to schedule a natural history study. And in the retrospective studies, you take the data from existing medical records, which are actually not meant for natural history, but for diagnosis and therapy. So usually it is incomplete, and it does not have any uniformity in the data collection. But however, they can organize important information from this existing data about a disease and identify information gaps. And these can be addressed in the prospective data collection and analysis, like what we plan to do for the GNE natural history study if the Mayo mission program or the project is approved. So retrospective natural history studies may be performed. Yeah.
Dr. Nalini, 2 more minutes.
Okay, thank you. More quickly than prospective natural history studies, particularly for rare and chronic disorders. So in prospective studies, the evaluations occur in the future according to a pre-specified data collection plan that may reflect current data studies. So it also helps in identifying the patient population and a comprehensive knowledge which can conduct adequate and well-controlled trials. And we should have meaningful endpoints and adequate duration. So a well-designed study is useful in understanding which patient subgroups can benefit from a particular drug. So we need to identify inclusion criteria based on the natural history studies, and also what are the clinical outcome assessments. And natural history helps to evaluate the ability of new or existing clinical outcome assessments. So like in NIMHANS cohort, we have about 151 cases of GNE myopathy confirmed till date. And we have a follow-up on almost 101 patients of a mean of 3 months, 2.9 months, almost 17 long years follow-up. And we found that the wheelchair-bound state occurred at around 32 years and bed-bound state around 42 years. So having some natural history data, or what we call as a disease progression of a disease like GNE myopathy, is very crucial to plan a prospective study so that we know what parameters to be included. Okay. So in conclusion, natural history study collects information about the natural course of the disease, and the knowledge is critical to inform trial design for selection. So we have to appropriate population or subpopulations, like in GNE myopathy, different patterns of genetic mutations which are available. So we have to group them as subpopulations and do drug trials and not take them as a uniform group. We can also have most efficient informative trial designs. So finally, natural history studies are essential for rare disease research and can potentially replace placebo arms in clinical trials. Yeah. So thank you so much and for inviting me for this talk.
Thank you so much, Dr. Nalini. That was indeed very insightful. Now over to Dr. Vishnu. Dr. Vishnu, the importance of telemedicine. How does it work and how can patients benefit from it? Up to you now.
Yeah, okay. Thank you. Can you hear me?
Yes.
Okay. So at the outset, I'd like to thank Dr. Alok, Dr. Sudha, and everyone at the WWGM for giving me this opportunity to talk about telemedicine. So telemedicine, 1.5 years back, it was new for me also. For COVID is the one which forced us all into the field of telemedicine. I still remember the day when the national lockdown was initiated in March, and the very next outpatient clinic, we were given one telephone handset and say that so start calling up patients for your follow-up patients and do the telemedicine. That was the crude telemedicine that we started on in the end of March. And the neurology department at AIIMS was one of the first department to start the telephone telemedicine services in AIIMS at that point of time. So later on, we realized that once we started calling phone, I mean, it's easy to do it for follow-up patients, which we know previously, but for entirely new patients, for a telephone-based services, they had its own limitations especially for a new patient, and our outpatient services were all closed at that point of time. So we tried for the video services. We were given option of doing a video consultation at that point of time. So a lot of we had the Medical Council of India's regulations for telemedicine and all came up. So the one most important thing was the patient confidentiality about how the video recordings have been conducted, whether the data is being served. When you use a Zoom or a Google Meet or many other services, whether data is being served, is stored, that was an issue at that point of time. So AIIMS came up with an open platform called Jitsi Meet with a server in the AIIMS itself. So the data was being stored in AIIMS server in our institute itself. So that's how we started that's when we started the AIIMS in neuromuscular telemedicine services in August at that point of time. So over a period of from August to December, so we had around 322 applications. I mean, for emails we received for a telemedicine consultation at that point of time. We were able to give appointments to around 287 patients, and we had completed for around 182 patients on this one. Around 100 patients didn't respond after the first email. It just came after the first email. When we responded back, we didn't get any response. Most of the time, email was done on behalf of somebody else, and probably that person didn't respond later on that. We had given a dedicated email service and a WhatsApp number for them to contact us. So we looked at the number of contacts we had. We had an average of around 6 email exchanges between the patient and our coordinator before we could finalize a date for a teleconsult. Then we had in the WhatsApp around 15 messages were exchanged on average before we could finalize the final date and timing of the teleconsults. So a lot of times we could achieve the first time teleconsults in around only 50%. of patients, like in the first go, we could achieve the teleconsultations. Rest of the time, most of the time, we couldn't achieve that. One, the familiarity, because Jitsi Meet app was not very familiar for everyone. So to get the app downloaded and use it, it was little, and the first time it was a little difficult for patients. Once they got used to it, it was easier. Then there was a lot of around 30%, the patients didn't turn up at that point of time when that then around 17-20% I couldn't join at the time because something emergency had come up. And surprisingly, we were looking that connectivity will be an issue in many places, but at least it was issue only in around 10-15% most of the time. Connectivity was really not that issue. I mean, that's something which our country should be proud of in this era of tele services that we could achieve, because I have done teleconsult with patients sitting on roadside, patients sitting on tea shops, patients sitting on, I mean, at all places. So at least we could connect to patients in multiple areas at that point of time. So from my experience of doing teleconsultations over for the last 1 year, it's been useful to the patients. One, most of the patients have been seen, at least in the inherited neuromuscular disorders. One advantage that I had was it was usually seen by a neurologist before. Somebody would have seen them before. So that helps in making a diagnosis or a confidence in the diagnosis that we make. Because beyond a point, you can't examine the patient through the video. So I have developed myself some protocol for examining patients. Like there's a protocol that we follow for all patients for examining upper limb, lower limb. They make them walk, the gait. So we follow a specific routine to find out, at least we get a rough idea of how much deficit patient has, what are the muscles grossly involved. So that we can unless if it is seen by another neurologist, it's easy to achieve. So, and the other, usually people achieve, the aim of a telemedicine services differ from different patients from different parts of the country. For some, it is mainly for a diagnostic purpose. So that they know that a diagnostic is being conducted. So at that point of time, so when you do a telemedicine consultation, so they want a diagnosis to be done. So they want to give a blood sample. For that purpose, they do a teleconsult. So sometimes they're not interested in a detailed examination and all. They say, "Oh, my diagnosis has already been made." So they just want to get the testing done. That's one. Second point is, people want a second opinion on the teleconsults, which the diagnosis has already been made, and for them, it is a more detailed examination which they're more interested in. So, and so the aim of each patient is different from that. Second thing, and third category is one, they want to know about more about any management options, anything else is there currently. They want to get in touch with for any latest trials or something happening ongoing in their particular disease at that point of time. So these are the main consults that we used to get for a teleconsult. And main problem that I faced after the teleconsults is, once they send the sample, for example, for a diagnostic purpose, they send the sample. So many of the people consider it as a laboratory testing. You send the sample and you want to report the next week or the next month report. So we try to explain that this happens in a research setting and we may not get the testing out reports immediately. So the delay is something many patients can't take. So that is also some issue happening. And telemedicine services, which we conducted almost about a year. We got a break when the massive COVID second wave occurred in Delhi at that point of time. Even I was posted in the COVID ICU. So I was out of the AIIMS itself. I was in the National Cancer Institute in Jajjar. So at that time we had a long break of, we couldn't do the tele services during at that point. And we were trying to get it back on place. So these are my experience with the telemedicine thing. Happy to take any questions.
Neetu has asked a question in the chat box. When will the gene test report come?
So whatever sample we have collected, we have sent to our testing center at CCMB Hyderabad. So we are in the process of getting it analyzed. I think we should get in a couple of months the reports. So the problem was the COVID. If the COVID was not there, we could have done this much earlier. Because the COVID was there, everything was shut down. So now we are just trying to get it back in place.
Actually, I want to ask Dr. Nalini, can you suggest some Ayurvedic medicine or something, some else treatment? So it is parallel to, we are consuming some CoQ right now. So is there any else we can do?
You wanted to know about Ayurveda medicines, is it?
Yes. Otherwise, Ayurveda. Otherwise, any other.
I think Professor Khadilkar and I mean also mentioned, and it's very clear that there's no specific drug, because here it is not any enzyme defect or it is a metabolic defect where you can replace it with either any vitamins or with enzyme replacement. So it's actually a gene defect. So if you are doing well and healthy, apart from the muscle weakness, I don't think anything of this will help. Yes, in NIMHANS, we have advanced center for Ayurveda in neurological disorders, and almost all of our patients do get some form, and particularly the main component is ashwagandha. And I think there are some natural steroids in ashwagandha, and it gives them a feeling of well-being. And apart from that, yes, they do a lot of other therapy in Ayurveda with the oil baths and swana bath. And if patients have some contractures or have some tightness of the muscles, it gets relieved. And many of them are very happy with the Ayurveda treatment, at least. But I don't have first-hand experience because I'm not I don't read Ayurveda or I don't practice Ayurveda, so it's very difficult for me to say. But well, at NIMHANS, almost all our patients with neuromuscular disorders do take some form of Ayurvedic medication which is prescribed to them, and also there are some programmed Ayurvedic treatment for these patients. Yeah, but drugs, even CoQ10, I have not read or learned that it would be of any use. It's pretty expensive, and I don't know whether it will serve the purpose for what it is being taken for.
Okay.
Thank you, Dr. Nalini.
Yes.
Ashish, you are next.
Question to Dr. Vishnu. Are there any registries at AIIMS or by the central government, any plans of registry for GNE myopathy or rare diseases in general?
So thank you for the question. So yeah, as there are two things in issue. I mean, two things involved here. One, as part of the Myo Mission project and the GNE registry program that Dr. Nalini was talking about, so I think Dr. Sudha Madam is trying to bring in the national GNE registry part. So whenever that comes into at AIIMS, also will be a part of it, and we would like to contribute to whatever way we can. So what is ongoing now currently is we have the International Center for Genomic and Genomic Neuromuscular Disease registry going on. So in that we have collect patient data of all inherited neuromuscular disorders, including GNE myopathies. There's an ongoing patient database is already there, which we have now close to 800 patients now of all inherited neuromuscular disorders for the last 1.5 years. So that's ongoing.
Can I interrupt? Yeah. See, with regard to rare disorders registry, ICMR has started about October 2019 on rare disorders registry for various rare disorders, and NIMHANS, and I think Dr. Vishwanathan, then PGI, Chandigarh, and AIIMS, pediatric department of AIIMS, Madhulika Kabra and Shifali. A part of this thing, NIMHANS is the nodal center, and it is for several hemoglobinopathies, I mean various rare disorders. But in neuromuscular disorders, they have only included Duchenne muscular dystrophy, spinal muscular atrophy, and limb girdle muscular dystrophy. For various reasons, they said that we can start with these three initially and then possibly extend as depending on the response and how the registry goes on. So for these three neuromuscular diseases, the registry is going on for the last 1.5 years. So ICMR should take it up to expand for all inherited neuromuscular disorders. And I think Professor Alok and all who are there at Delhi should insist that ICMR, so that the entire GNE group also can go into the national registry.
Thank you very much, Dr. Vishnu and Dr. Nalini. Chetna, you're next. Chetna, you can go ahead and ask your question.
यस मीन्स अपने जो पैर के जो मसल्स होते हैं, तो मीन्स जब स्टार्टिंग में मेरा डिटेक्ट हुआ था तो मसल्स ऐसे लबडप होते जाते थे, मीन्स ऐसे लगता है कि कोई मीन्स वहाँ पे एक्शन होती है ऊपर नीचे. तो अभी कैसे मीन्स हैपन हो रहा है मेरे केस में, मेरे पीठ के जो मसल्स है तो वो भी ऐसे कंटिन्यूअसली लबडप होते जाते हैं. तो उस पे हम कुछ मीन्स दवा वगैरह कुछ ले सकते हैं क्या, टैबलेट वगैरह?
Dr. Nalini, would you like to answer this?
I'm not sure.
I can just translate a little bit in English.
No, I understood, Shilpi, but what exactly is lubdub? Is it fasciculations, what she's telling, or it is myokymia, or is it cramps? I don't know. Is it painful, not painful? So we need to know. Chetna, तो बोल सकती हो कि वो is it painful or no? दर्द होता है कि नहीं?
No, it's not painful, or it's not like a cramp, but I think it's some movement, like up and down.
Is
the muscle jumping?
Is your muscle vibrating?
Yes, like, yes, vibrating.
Vibration जैसा?
Or twitching feeling? Twitching?
No, like that.
नहीं, अपना phone कैसा vibrate होता है, ऐसा कुछ होता है?
Like that means वो भी बोल सकते हैं, but लेकिन क्या बोलूं मैं? Up and down means
लोकल थोड़ा सा वाइब्रेशन रहता है कुछ पर्टिकुलर एरिया में, लाइक थोड़ा सा ऊपर नीचे कुछ ये हो जाता है।
मीन्स ऐसा लगता है कि कुछ तो भी हिल रहा है वहां पे, ऐसा मसल्स।
I think she is mentioning like heartbeat kind of a thing, like how we get heartbeat sound or the feel. The same thing we get it on the cuff muscles or sometimes stomach, near to the stomach, something like that.
Possible. I'm not sure what exactly she has, but she's confirmed case of GNE myopathy, isn't it? All of them who are participating here.
Yes, doctor. I'm Trupti here. So even I feel the same thing. That's why I interfere.
Okay. Yeah.
Sorry, can I just mention, I'm a GNE patient in London, and it's like palpitations, literally. It's like twitching and jumping.
Correct. Yeah, palpitation, yes.
But no pain.
No pain at all.
Yeah.
But I get it sometimes on my stomach, my left side stomach, and sometimes on my hand or the cuff muscles.
I normally get it on my thighs or calf muscles or anywhere in the legs or arms.
Guys, can we let Dr. Nalini answer this, please?
Yeah. Okay. I think, see, in many diseases where the muscle is sort of degenerating, no, or it is dying, when the muscle is dying, and during the process of death, the muscle starts muscle has a propensity for self-activation, or it has an inherent capability of contracting. So sometimes we call it as myokymia also, where groups of muscles will start contracting and there will be like a rippling sort of a movement of the muscle. So as you're telling, vibrating or something that karta hai. So it could be a rippling sort of a thing, or a wave that just flows on the muscle. So it's more commonly like in anterior horn diseases like motor neuron disease or spinal muscular atrophy. But here also in the primary muscle diseases, we can have such changes or muscles contracting spontaneously, and it could be myokymia. I think this is the best explanation that I can think of.
Okay, we have just time for two more questions.
Sorry to interrupt, but Dr. Nalini, could you suggest something for Chetna because she's in discomfort?
Is Chetna really disturbed because of this? I'm not sure. Or it's just a phenomenon which keeps coming and going. Like sometimes we have eyelid twitching, when we are watching the computer for a long time, our eyelid starts fluttering very frequently, or sometimes for 2-3 minutes, and it just goes away. So we just don't bother about the small things, because there's no specific treatment for these things. That's the reason.
Means it irritating me in nights as well. Means इतना irritate करता है वो कि मुझे नींद नहीं आती है.
Okay. Why don't you try with the vitamin E? I'm just thinking. Vitamin E, which could just sometimes we do give for muscle diseases. And maybe Shilpi, you can just send in an email or something, and I can officially write some of these muscle tonics, and it might help also. Like coenzyme Q10 or carnitine or vitamin E, or even just plain vitamin C also. So I'll definitely write that for you, Chetna.
Yes, thank you.
Yeah, you're most welcome.
Pallavi asks, so basically another problem everyone is facing is swelling. What can patients do to reduce, avoid any kind of inflammation, swelling?
Yeah, so you see, the swelling depends upon two. One, there is a reduced movement, if there is a dependent swelling at that point of time, because your weakness, the limb is in a dependent position, that is the one which is causing a swelling. Or if there is a concomitant secondary joint problem, due to an ill-fitting prosthesis or due to an or some other positioning problems. So usually primarily muscle disease as such causing swelling is little, unless it's a direct muscle involvement of a muscle hypertrophy or something. Otherwise, to cause a muscle or we usually see swelling otherwise in like something sometimes acquired muscle disease like for a myoedema or something like that. Otherwise, to swelling directly occurring in a muscle is rare. So it usually is a secondary problem. You have to find out the cause for the swelling at that point of time and trying to treat the cause. So mostly the swellings that I commonly usually see is a dependent edema because the limb is usually hanging down, and those causing, whether it is in the upper limb, in the hands, in the limbs hanging down, or in the lower limbs. So that simple positioning, changing the position, into a non-dependent, non-gravity dependent position itself, rather than a medication, that itself can solve it.
Thank you very much.
Thank you. Rishabh, can I just add on to what Dr. Vishnu said? See, when patients have these muscle diseases, the tone or the primary elasticity of the muscle reduces. So when the tone of the muscle reduces, it's very flabby. And when it is very flabby, the blood vessels are also the tone of the blood vessels also reduces, so that there is some amount of fluid which gets out of the blood vessels. And also these muscles in these patients are not constantly contracting or not to its full capacity, and which can pump back all the blood which is in the periphery of the limbs. And if they're sitting for longer hours, obviously they can have dependent edema. So the tone of the muscles also plays a major role in maintaining the the dryness of the limbs. So there may be some swelling because the muscles are very flabby, and then the blood vessels also become flabby because of that.
Sure. Thank you very much, Dr. Nalini. Vikash, you are next. This is the last question which we will take from the audience. Vikash, please go ahead.
मैम मेरा ना जो LFT कराता हूँ हमेशा, उसपे SGOT और SGPT करके पैरामीटर है, वो हमेशा इंक्रीज रहता है, तो ये GNE के कारण हो सकता है क्या?
Dr. Vishnu, Dr. Nalini?
How high is it? How much is it?
SGOT 78 and SGPT 109.
Okay. So see, basically several muscle diseases, more commonly like in limb girdle and in Duchenne muscular dystrophy, it's very common to see that the liver enzymes are also elevated. GNE, yes, but not so much, maybe in 40s and 50s. So I'm not sure what's the highest level you can have, but muscle diseases are well known to have liver enzyme, just like creatine kinase, which is elevated. You can also have elevated liver enzymes. It just doesn't help us much to say as to why it happens, because these defects are well known as part of the disease process.
Yeah, to add on to that, if you have a strong suspicion of a liver disease as such, you can do a GGT enzyme. If it's the source is the liver, then the GGT will be always elevated. If the GGT is normal and only the mild elevation of liver enzymes, that could be part of the muscle disease as well. We don't have to do anything much for that.
Okay.
Thank you very much, doctors. Just one last question, which is quite popular to both of you. This is the last question. How can patients stay positive and mentally strong while living with GNE myopathy? We have seen and observed that, if we have a strong mind, if we keep our mind very healthy, it can really help in living a healthy life, even with this condition. Just small comments from each of the doctors, please.
Okay, I'll start off with, because today morning only I gave a pep talk to one of the patients. So I always say, this is a good time to talk, because the Paralympics just finished, the Paralympic Olympic tournament. I always tell them, if the Paralympics can bring more gold medals than the normal individuals, that we are 1.2 billion individuals here who can bring only one gold medal, 1.2 billion healthy normal individuals can bring only one gold medal, and the Paralympics can bring more gold medals and fame to our country, and the totally wheelchair dependent patients can climb the Mount Everest. So it's it's your mind and attitude that determines your outlook. So we all have to face some sort of issues in your life. Whether some people have physical issues, some people may have mental issues, some people may have family issues. Each one of us has our own and our own, what do you call it? Everyone has some issues with us. So we have to handle it. Some things which have been under our control, some things are beyond our control. So a disease, a genetic diagnosis is not under your control. So once we got it, now it's just thing is that not to get bogged down by it, to overcome it and stay with a positive attitude and live beyond what we can. So if Stephen Hawkinson with an ALS on a ventilator can achieve more than what many of us can even dream of, it's the attitude and it's the life, what is ahead, and what you think about what you want to have with your life ahead, that matters.
Thank you, Dr. Vishnu. Quick comment from Dr. Nalini.
No, I think Vishnu has told. So for this particular comment, because you had sent already, I asked my experienced social worker to Dr. Priya Thomas to help me with it, because it would be nice to get some words. And obviously she had sent me a long note on everything. But as he said, it has to be for every single person who's affected with any of these diseases which are progressive. Focus on your well-being. Focus on the positive aspects as to what you can do currently and in the future, and do not keep dwell yourself in the genetic diagnosis of your disease and why this genetic disease has affected you or affected any other family member. So be positive, as you said already. And healthcare providers should give realistic expectations for the future models for all of these patients, and do not give unrealistic models for the individual or the family. So, and they can plan their future and find solutions for existing problems and learn to live a positive life with existing disability and achieve a lot. And all of the GNE myopathy patients have excellent brains and excellent motivation and enthusiasm. I'm sure that sitting in a place you can rule the country and rule the world. And I think that's what is my information, and which I also got from our experienced Dr. Priya Thomas, who deals with all the neuromuscular disorders for the last 20 years and has learned from these patients. And what best is to have a focused attitude towards all that you have, positive things in your life, and not dwell into the genetic disorder that you are suffering from.